to us are the little things that accumulate over time, things that we can do on the unit that bother us, but we don't really speak about it so much. So we want them to hear what they're saying, and we want to help get rid of those pebbles.
Mm-hmm. It's those little things that every day just start to build up until you want to explode. And it can be something so small and simple that, it's fixable. So trying to identify those and have staff identify, what's the things that are wearing you out, so that we can help do something about it and maybe change a process or a routine or something like that.
We had a couple different pebbles. We actually identify them as like pebbles, stones, and boulders, because we noticed that it's sometimes bigger than just a pebble for some nurses. We had some like room turnover, meaning we were cleaning the rooms faster, work-life balance, staff room cleanliness, like our locker rooms.
And I think too, just the things like if a patient would be discharged, who owns the equipment in the room and cleaning certain things, and all of a sudden you're finding equipment in the room, in the hall, and the room's not ready when the patient comes, and working with our EVS or our housekeeping partners to identify ownership, and doing that, like we were able to decrease turnover time by 10% for the rooms, getting the patients in earlier. And so one little pebble that was causing all this strife for even the housekeeping department ended up being a bigger project that got the patients in sooner so they could start their chemo sooner, and things were better with that respect. But a little pebble was coming into the break room and having everyone's dishes in there from the week before, and nobody wanted to clean it up. So just getting ownership with that, and putting deadlines, like anything in this sink is going to be thrown out on Friday. You just have to do that once or twice, and people like their dishes. They have that certain spoon that they have to use. And I think just making sure that they have the dish soap and the sponges and the little things like that that make it look nice and more homey. And the problem was gone. I mean, people owned it after that. So.
We also had nurses. We have phones in our pods next to every room. And when nurses would call certain areas like CT or MRI, there was phone numbers not always listed. So we asked for everybody's response of what areas would be really important for them to know the numbers to, so they're not searching for these things. We got a big response from that because they were really excited to have all that available. Work-life balance, we decided to ask about that kind of stuff with meetings. And they said that they don't like monthly information, more quarterly, that's a little longer. And then we did a scheduling committee out of that work-life balance, because their PTO and having off was really important to them, and using their PTO. So we got into a scheduling committee, and we were able to work a lot of things into just our work-life balance, which someone was irritated with just something, which we brought it into a bigger spectrum of things.
Another thing that came up too is just having a place to go, like a crying room, someplace you can debrief after an event, because like something will happen, but this patient is being admitted, you have to flip it now and go take that patient. So giving people a space, which we're sitting in right now, but giving them a space that they can go and just do a little decompression for a couple minutes before they move on and switch over to that next task. A bigger project we've worked on is nurse-provider communication, which we know has always been a problem anywhere you go, right? So we have a lot of residents that come to our floor, and we had a nurse that worked on a project for that, ended up being where she gave them an orientation every month when they came to our unit. 15, 20 minutes, kind of gave them their resources, introduced them to different people. They knew a little bit more of the layout and how our process was every day, so they could help us out and conform to that. They were able to, get their work done and give us what we needed as far as communication and goals of care and all those things. But we also started taking pictures of staff and the providers so they could identify each other too, because when we were wearing masks, it was really hard, then they take them off and you don't know who it is. So we have pictures of who the providers are on for that month, as well as we're making a staff board now too, so they can identify people as well. And that all came out of people saying, I can't, get any information about my patient. It was a pebble and more of a boulder.
Yeah. a boulder.
And we turned that into more of a communication thing that now can happen on a regular basis. So.
There's just a couple that we felt was really important. Be patient and follow through, even when it can't be solved. We know there's issues that we can't always solve, and having the understanding that staff know that and that we know that.
Yeah, and I think transparency with them, like there's certain things that are boundaries that are out of our control. It's out of our scope. We probably can't address that, but we can certainly escalate it to the people that need to know about it. But I think making sure that they know where we are with the process, because there was a couple times that we didn't loop them in. So then they thought it was like, are we not doing this anymore? So we learned on our own too, like we really have to keep communicating, like this is where we're at. We're doing a project now with chemo consents and trying to be able to find those in charts. And it kind of fell by the wayside, mainly because we're in the process of escalating it. So they thought we weren't working on it anymore. So just having to go back and revisit and say, hey, by the way, we didn't forget about that, because we don't want them to stop using the venue. We want them to know that, some things are just going to take longer than others. Some are simple fixes.
Yeah.
Others are just going to be bigger projects.
Yeah.